Diabetes is a huge problem in the United States. In the past 20 years, the prevalence of people diagnosed with diabetes has increased 200%, with over 22 million people living with diabetes. While the incidence of people diagnosed has decreased in the past few years, the millions of people living with diabetes continues to increase. Before we get into why that's such a big deal, let's start with what diabetes is. There are two main types. Type 1, also referred to as juvenile diabetes. Type 1 diabetes is where the immune system attacks the insulin cells in the pancreas. Then there's type 2, often referred to as adult onset. It's far more prevalent than type 1. Here, the pancreas does not naturally produce enough insulin to keep sugar from building up in the blood, or the cells are resistant to the insulin the body is able to produce. Why does it matter that millions of Americans have diabetes? The disease has long-term physical effects, and the cost associated with managing it has only increased for patients and the hospitals that treat them. Millions are admitted each year, and many will find themselves readmitted to a hospital in the same year or even in less than 30 days, which brings us to what our capstone is trying to accomplish. We're Team CARE, Cost and Readmission Efficiency. We're trying to predict the highest risk patients, the ones that will be readmitted to the hospital. Our data has over 100,000 patient records that span 10 years and 130 hospitals. From our data, we know whether the patient was not readmitted within a year, or readmitted in less than 30 days. About 11% of the patients in this set were readmitted in less than 30 days. We have demographic variables that show us that we have a pretty balanced data set when it comes to the target variable across both age and race. Depending on what we find, we'll want to suggest a potential solution for hospitals or patients. Whatever we find, we know we'll want to target the population that's hit hardest by readmissions. Here, you see that the most people readmitted to a hospital are between 65 and 85 years old. We'll also want to make sure our focus is in the area hit hardest by diabetes. The map shows that the Southeast has the highest prevalence of people with diabetes, and the number in these areas is still growing. Colorado and surrounding states like Utah and Wyoming have some of the lowest rates of diabetes, and perhaps there is a way we can learn if the differences between these states have something to tell us in terms of solving the problem. The more we can prevent the admission of diabetic patients to the hospital, the more cost savings for our healthcare system, and the better we can improve outcomes for patients living with diabetes.